Germany has a system where people can compare hospital services. It's kind of like a TripAdvisor for medical treatment. But can it work here? Well, the people at the Montreal Economic Institute thinks the timing might be just right for something like this. Youri Chassin joins us now. How does it work exactly in Germany? They have mandatory reporting that they have to do, right?
Exactly. The government requires the hospital to measure some quality indicators and make them available for patients and referring doctors too. So sometimes at the MEI, we like to fish for good ideas abroad, and this one struck us as a really good thing that could be implemented in Quebec, actually.
How realistic is it, though, do you think, to get Quebec hospitals to start making reports on how they do?
There's a lot of data already compiled, but it's not made available. And obviously, in Germany, for example, they have an institute that take care of selecting which indicators would be the most relevant. Once this is set, every 2 years, they have to measure it and make it available. Obviously, allowing patients to choose more wisely their hospitals and compare them with pretty user-friendly tools.
Now, it's interesting because, you use the TripAdvisor analogy. With TripAdvisor, you get to see, where the hotels are cheapest and what. With healthcare here, it's not about the money, obviously. So then we would get to compare, what, medical errors, success rates?
Absolutely. So there's this. When the price is not a factor, as in healthcare, the quality is so important. And basically what we have, like what the measures are in Germany are quality indicators such as the patient's recommendations first, but also the availability of the relevant equipment. For example, how many operations of one type are conducted in a particular hospital, and are they above average in their region? Are they below average nationally? So this kind of comparison allows you to say, well, maybe I'm more focused on the quality of care for the hip replacement that I'm looking, and not the overall care on all the surgeries, for example.
So this is interesting because then it would actually force hospitals to improve their performance, right? Because I think the way we look at now is, go to any hospital and they're all pretty much the same.
Yeah,
right?
Well, it's not exactly that. We rely basically on proximity and word of mouth because there are differences between hospitals. For example, when the Jewish hospital last year actually was said to receive a lot more patients because their emergency care...
It's word of mouth.
Exactly, were really good. They received a lot of more patients, but not more financing, right? So this is something that they have done in Germany. Not only are they stressing transparency, but also that the money follows the patients. And this is something that our health minister in Quebec is trying to implement right now. So along with this activity-based funding, the transparency would be really perfect. It would be a combination that would make a quantum leap in the quality of care in Quebec.
Obviously, there are critics to this. I think the two main criticisms are that it's too expensive to do it, but also the main one seems to be, doctors and hospitals are always very proprietary about their information, and they'll say, well, we have these reports, but the patients will never understand them. They will misread the reports. What do you say to that?
Well, there are great tools, basically insurers or even user groups are making great tools to compare different indicators, and those indicators are pretty well designed. First, obviously, it's about $20 million. So it's a principle, right? Do we want patients to be empowered? I think yes.
And they do understand the reports.
They do understand the report, basically because it's formatted so they can. And also, the doctors can appreciate the comparison too, and maybe, adopt the best practices that they can see in a hospital making better indicators than them, right?
Interesting. Always interesting, Youri. Thank you so much.
No problem.
And if you want more information, if you want us actually look at the report, it's on the Montreal Economic Institute website, IEDM.org. And thanks again for coming in.
No problem.